All right. Thank you everyone for joining the AMSSM Journal Club introduction meeting. My name is Anna Bueller. I am the internal medicine representative on the Sports Medicine Resident Council, and I'm a PGY3 at the University of Colorado. And then I'll have everyone else introduce themselves. Josh.
Hi, good evening, everyone. My name is Josh Romero, this year's SMRC president, and currently a PGY4 and PM&R at Mayo Clinic in Rochester. Glad to have everyone here this evening.
Carol.
Hey guys, I'm Carol Chang and I'm the PM&R rep for the SMRC, and I'm currently a PGY4 at Rush in Chicago.
And Jess.
Hi everybody, my name is Jessica Buttinger. I'm the Medical Student Interest Group president for this year, and I'm a fourth-year medical student at Central Michigan University.
Our plan for this session is to go over the objectives of the Journal Club, the structure of what this will look like, how to specifically structure your presentation, going into an example of kind of the classic Journal Club presentation, and then reviewing basic statistics and terminology. So the objectives of this session are to learn how to become involved in the Journal Club, understand the basics of presenting at the Journal Club, and then from there, we hope that this will make everyone feel more comfortable and excited and interested in signing up. And Jess, do you want to talk about the objectives?
Yeah, absolutely. So we came up with some, key objectives for the Journal Club all together. These will be posted on the AMSSM website, so you can go and look there as well. So the first one is our objective is to practice reviewing and appraising journal articles all together, to learn about the top 120 AMSSM recommended articles. This is an opportunity for mentorship and to engage with other AMSSM members and students and residents. This is really an opportunity to all come together and to have fun learning sports medicine, something that we're all passionate about. Some things that we do not want this journal club to be is the attention is to not look at the newest, most cutting edge research of 2022. And you do not have to feel like this is going to be graded or critiqued. This is really supposed to be light and fun, and just a great opportunity to learn together.
So our format for this is tonight is our first meeting as an introductory meeting. And then we plan on having about quarterly or maybe more frequent meetings with the actual journal clubs starting up in September. Joan will send out a sign up link, and this is also accessible on the AMSSM website. For the journal club's medical students or residents, we'll be able to present an article from a predetermined list. And then when they're assigned their article, they will have the opportunity to have input from a mentor who can help them and kind of guide them through their presentation. There will also be one AMSSM faculty member present during each session who will be able to kind of answer questions more broadly about all of the articles during that session. And then we intend for each session to be about an hour with at most 3 articles presented in about 20-minute blocks. And the goal would be to have your presentation shorter than 20 minutes so that you can leave room for 5 or so minutes of questions at the end. And then everyone will have access to supplemental documents to help them work on their presentation on the AMSSM website. So first, we're going to review how to make the presentation. And this is an example of kind of the typical classic journal club presentation. You may find that you want to deviate from this when talking with your mentor about your specific article. So the typical format will be to have a background and overview, a method section, results, discussion, and references. In your background and overview, it's always helpful to have a list of the learning objectives so that your audience understands what they want to get out of the presentation. And then also to make sure you have clearly stated the goal of the study that you're looking at. With that, going over the relevance and then going into any important background, like prior research that has been done on the topic, and then other things that might help everyone follow along, like important terms, physiology, mechanisms, exam maneuvers, anything that's brought up in the study that may not be the study itself, but helpful information for understanding it. So we have an example. This is not one of the articles that's on that list. So in this study, they had compared subacromial corticosteroid injections to physical therapy for unilateral shoulder impingement syndrome. And in the very beginning, they have a slide going over the objectives that they have for their audience. And then they also had fun. So we wanted to make it clear that you can make your presentation your own and have fun with it as well. They also included a slide on the relevance. In this case, both steroid injections and PT were used to treat this problem, and there were some prior studies, but none of them were answering the questions that this study wanted to specifically answer. And then they had a slide specifically reminding everyone of the research question. Since this specific topic, shoulder impingement syndrome, has kind of some helpful information to know, they included anatomy, review of the procedure, and then review of exam maneuvers that were mentioned in the study. So the next section would be what we call the methods, and then reviewing something we call PICO. So it's helpful to identify what kind of design the study was. And so that can be kind of any of these things on this list. And then when answering kind of your research, what is the research question, it's helpful to understand this PICO acronym. So that stands for population, and understanding the inclusion criteria and exclusion criteria for your study, what the interventions and controls were, the timing and the follow-up for that, and then the outcomes. And in many studies, for example, an outcome might be something like pain, and those are going to be quantified by different tools or scales. So it's helpful to make sure you discuss those as well. Whereas something like a blood pressure value is very simple to report. Some of these have more complex ways that they do it. So in this example, they reviewed both the inclusion and exclusion criteria for their study population, thinking about the age range, where people were recruited from, what they needed to present with to be included in the study, and then on the flip side, what things kept them out of the study. And then they reviewed the intervention and control, making sure to note the follow-ups and how those were addressed. Here they reviewed the outcome measures. In this case, for this study, pain was one of the outcomes that was studied. And so it was helpful to identify the different scales that were used and how they were generally created in quantifying that pain. They also had secondary outcomes that they reviewed as well. In your next section, it's helpful to go over the results. This can be the sample of the population that was involved, so the size and the characteristics. Now going over the data of the primary and secondary outcomes, including statistical significance, adverse outcomes, and then a summary of the results as well. This is a helpful place to include things like figures from the study so that your audience can follow along, especially if those visuals make it easy to understand. So at the top, you can see how they reviewed the primary outcomes. That figure there is very helpful to kind of understand that both of the treatments had improvement, but neither was actually superior to the other. And then they also reviewed the secondary outcomes of both these specific pain scales and healthcare use, and kind of broke it down a little bit further with some notes. Your next section is a discussion. This is where you'll want to address some critical appraisal questions. Those can be found in the documents on AMSSM's website. And then thinking about the study's inequality or limitations, conclusions of the study, how it applies to patient care, thinking about generalizability, different populations, and then how it might change future studies or what next studies need to be done. And then lastly, making sure you kind of think about any personal conclusions and how this has changed your practice. So these are some typical critical appraisal questions. They may not apply to every study, but it's helpful to answer these if you can. Were the treatment and control groups similar at the start of the study? Were the patients randomized and was the process concealed or blinded? Were the patients analyzed according to their treatment group? Were the two groups treated similarly otherwise? And was the follow-up complete? If a study has a diagnostic test, making sure they had compared it to the gold standard is important as well. So here, again, they had a slide just going over the design and validity, just very specifically answering those critical appraisal questions. They brought up some limitations, and those are going to be very specific to the study often, but thinking about, whether there was crossover, whether there was blinding, how they may have defined certain terms that they were looking at, the authors, different people involved, placebo effect. You might find a variety of limitations when you're looking at studies. And then lastly, making sure you go over your conclusions. This might be a place where your mentor or the advisor also has some good kind of input as someone who has been practicing in the field and kind of is seeing these types of things every day. We wanted to make sure everyone knows where to find this. So if you go to the AMSSM website, you can click on the education tab. And then from there, click on either the residency or medical student tabs. And then there's a journal club link with Zoom link, resources, and signups. It looks the same on both the residency and medical student tabs. So now we'll have Carol do some basic statistical analysis review.
All right, so the next few slides, we're just going to go over very basic stats. This is mostly going to be focused on concepts and some terminology that you'll run into when you are looking at these studies. I know that I can get really overwhelmed by all these numbers and all these different tests, so you'll have a mentor to help you out with that. Next slide. All right, so as we talked about in the beginning, a lot of these studies, we are testing a hypothesis and then seeing if there is a difference and if it is true. So the alternative hypothesis is a statement that there is a difference between the variables. And a null hypothesis is that there is no difference. So a really basic question that you could have. So your alternative hypothesis could be that corticosteroid injections in the knee help with knee pain. And then your null hypothesis would be that it does not help. So a statistical analysis with a test will have been done, and then a p-value will be calculated. And the p-value is the probability of the event occurring by chance. So in simple words, the p-value is the evidence against the null hypothesis. So the smaller it is, the better, because then you can reject the null hypothesis. And a standard that we use is 0.05. So if it's less than that, we can reject the null hypothesis. And then when we are looking at these, looking at the null hypothesis, we can run into type 1 errors and type 2 errors. So type 1 error, or the alpha error, is that the null hypothesis is incorrectly rejected. So we're saying that there is a difference when there isn't. And then the type 2 error would be the opposite. So the null hypothesis is incorrectly retained. So the results said that there was no difference when there really was one. So the power is, the technical equation is 1 minus beta. So it's the probability of the study finding a difference given that one truly exists. A simple way to summarize that is power is the chance of not making a type 2 error. So the example I have is that the authors designed a study to have a power of more than 80%. So that means that the study was designed with at least an 80% chance of finding a difference between the treatment and control groups. And how we can avoid error and increase power is by increasing the sample size. That's the easiest way to do so. And other things that can affect the error would be bias, but it can sometimes be hard to recognize that there is bias at all. And I know that most people try to do their best to reduce the bias. Next slide. Oh, and sorry, at the end of that last slide, it was just naming a couple of the statistical tests that we use to calculate the p-value, but again, that would have been calculated for you. So this is just for those who are more conceptual and like to see these kind of graphs. You guys probably recognize these from when you were studying for step 1. So you guys can look back at this if this makes a little bit more sense on what I just talked about. Okay, next slide. Oh, I think it might have skipped one. Oh, there we go. So we can't talk about stats and the different tests without talking about sensitivity and specificity. So sensitivity, we use that to rule out, so it's good for screening tests. So it's the proportion of people with disease who test positive. So if there is a 100% sensitivity, that means then all the negative tests really are negative. You won't have any false negatives or false positive. And then if for specificity, you are ruling in, so it's a confirmatory test. So the proportion of people without the disease who test negative. So if you have 100% specificity, then all positive tests are true positives. So with this information, you can also calculate the positive predictive value and negative predictive value. So the positive predictive value is the proportion of positive tests that are true positives. So this is kind of, if you look at the graph, you can see that it's just kind of looking at it in an opposite way from the sensitivity. And then same goes with the negative predictive value. So the higher the specificity, the higher the positive predictive value, and the higher the sensitivity, the higher negative predictive value. All right, and the last slide. So the odds ratio, it is the odds of having a disease in an exposed group divided by the odds in the unexposed group. So it's examining the likelihood of an outcome in relationship to an exposure. So this is good for case control retrospective studies where you already have all of the results and you can look back. Whereas for a relative risk, these are usually looking at cohort and prospective studies. So you're looking at the probability of getting the disease in the exposed group. And then attributable risk is a proportion of cases attributed to one risk factor specifically. And then like the p-value that we were talking about before, the confidence interval is really important too, because it can also be tested with a bunch of tests that you don't really have to worry about too much, but it is an interval that contains a true population value. And in this example that I have, which is most commonly used, is a 95% confidence interval. You are 95% sure that the information and the values that you have contain the true population value and how it can pertain to a much larger study or a bigger population.
Josh, did you want to share your section now?
Would you mind stopping share screen and then I'll go ahead and do so. So, certainly just to continue the theme of what we've been talking about so far. So, thus far, really what the goal is that we're really trying to give you just a conceptual framework and some general guidelines on how to approach presenting an article and then how to approach the statistical portion of an article. And so to add to that, there's a paper that came out in BJSM last year. And for those who may not be as familiar with that, it's a very reputable journal for sports medicine. But this article came out last year. And really the goal of this article is to give primarily, it was more so created kind of for editors and authors of articles, a framework on approaching the statistical assessment for their respective paper. Although this paper certainly provides a very objective and checklist way to assess an article in terms of the statistical portion of it. And so we'll include this article just for your reference on the AMSSM website. Certainly, you don't necessarily need to use it. It's just another tool in your toolbox here to help you as you go through reviewing articles. So, in addition to this presentation, this paper will be there as well as your mentors. So we're just trying to give you as many tools as possible to help you in review these articles.
And one thing that I think is good to emphasize is when you are connected with your mentor, they will be able to help you with a lot of these things. And some of the articles aren't necessarily designed for this specific journal club format, but speaking with them about ways that might be helpful to present those articles is exactly why we wanted to get mentors involved in this. So that's one question that we have had from people. Otherwise, thanks everyone for joining. We're excited to get this started and keep an eye out for Joan's emails and check out the website to have more information and get signed up.
I'm looking forward to this initiative, everyone. So looking forward to the enthusiasm, mentorship, and being able to learn more and grow in this arena. So we're looking forward to this initiative moving forward.